Good afternoon, everybody. Hi, my name is Dr. Hoo Mei Lin, and I'm a gynecologist and fertility specialist at both Sunway Fertility Center and Sunway Specialist Center in Kota, Damansara. Thank you for joining us on this Facebook Live session today. The topic of this session will be sex during COVID-19, can or not? This session will run concurrently on both our Facebook accounts on Sunway Specialist Damansara and Sunway Fertility. We do have some questions already compiled which have been sending by our viewers. And as the session goes on, I hope there'll be more questions coming in from the rest of you. Okay, so we chose this topic because this topic is near and dear to my heart. It is something that keeps me in business after all. Okay, so sex during COVID-19. So the first question is, can we have sex during this time? The short answer is yes, okay? So we still can have sex. Sex is a great way to relieve stress, and we all know we are under enormous amount of stress now. Some of us financially, some of us just being cooped up at home for 24 hours, and if we've been really, really good, we've been cooped up for like a long time now. So some of us are really going a little bit stir crazy. The good news is that COVID-19 is not sexually transmitted. It is usually transmitted through droplets in the air. So that's why we recommend everyone wear a mask. I'm not wearing a mask at the moment because we are maintaining social distancing in my room, although we do have another person in the room with me running the camera because I can't do everything at once. Okay, so COVID-19 has not been proven to exist in vaginal fluid or in semen, so it is not sexually transmitted in a normal manner. So it's safe to have sex, but still you should have safe sex practices on mind. So you still need to wear the condom if you're not in a stable relationship, or if you're not keen to get pregnant. And if you're not keen to get pregnant, you still should use contraception. So now feel free to ask me questions at this time. We have started the session. So the second question that I've been asked, can I still have sex if my partner has flu-like symptoms? Now, of course, we all know that COVID-19, technically you get a bit of flu, fever, sore throat, cough. So if you suspect that you might have COVID-19, then we recommend that you socially isolate yourself for 2 weeks, which is the incubation period. Of course, there are some cases where the incubation period is longer, but I think 2 weeks is the standard recommended period. So if you're at home with your loved ones, then maybe you should just isolate yourself in the room so that you don't spread it to them. However, for peace of mind, it's good now that many centers have started providing screening, okay, and our center, Sunway Damansara, actually has a drive-through service now, and I'm so proud to be associated with this center because it is at such an affordable rate. So because it is at an affordable rate, and with in these last 3 weeks, because we are frontliners, I have personally come to contact with a very close call, and having access to screening really gives you that peace of mind. So if you do have flu-like symptoms and you are worried that it might be COVID-19, get tested. And then once you get tested, technically you should have a couple of tests to make sure that you're really negative, but at least then you know that you're okay and that you're not a danger to your loved ones. But let's say if in the heat of passion and you really cannot tahan and you still have these flu-like symptoms, I guess you can proceed wearing a mask. Might put a damper on things, but it might be a bit exciting. You can put a mask on, okay? So, we have a question, and it says, is it safe to get pregnant now during the COVID-19 outbreak? Well, we haven't advised people to stop getting pregnant, and sometimes accidents happen. We do know that pregnant women are not at an increased risk of getting COVID-19, but we also know that when you're pregnant, your immunity is a little bit altered, maybe even lowered. So if you do tend to get more sick when you are pregnant. So that is the only provisor. So we do think that if you get pregnant, then you really need to practice the social distancing, the hand washing, the hand sanitizing. You have to be a little bit obsessive. There has not been clearly proven that COVID-19 causes an increased risk of miscarriage or abnormalities to your developing baby. So far so good, but it is still early days, and so we do have limited experience. The other thing about getting pregnant at this time is because, as you know, COVID-19 is putting a lot of pressure and stress on our medical services. So the services that you could get during this time could be reduced. Now, if you're already pregnant, better not to miss any of your antenatal appointments. So your appointments with your doctors are still incredibly important. There are some appointments that maybe you can delay or skip, but it's best to speak to your doctor about this. So Grace has asked the same question, and I believe that I've already addressed it. So mom and baby, for the moment, from what we know, are safe. But of course, we really urge that if you're pregnant, maybe just get your husband or someone else to do your shopping. Try to wear a mask. The N95 mask, not really recommended in pregnancy because you find it a bit difficult to breathe. But so far, the normal 3-ply surgical mask is deemed quite safe. Okay, so let's go. Okay, number 4 is quite an interesting question. What if I meet someone new and I want to have sex? What to do then? Okay, so I think at this point in time, social distancing, we don't encourage people to go out, meet people and have sex. Better if you're in a stable relationship. But I guess you could do what doctors do. Okay, what we do is we ask, okay, have you been to anywhere that's suspicious? Did you go to such a building, the one that has been closed down because of, COVID? Or, maybe you could say, have you been in contact with anyone that's got COVID? Or the other thing you can say is, do you have any flu-like symptoms? All right? So if they answer yes to any of that, then no. Okay? So maybe just tell the fella to confine himself for 2 weeks, and then we see how lah. Okay? So if in 2 weeks it still survives, then it will be great. So if you meet someone new, just be careful. Actually, be careful at any time, not just during COVID-19, because you can catch things, right? Okay. Another question. My partner is a frontliner. Is it safe to have sex? Okay. I guess being a frontliner, well, I'm a frontliner. So is it still okay to have sex? Yes. But what we do recommend is that for all frontliners, when you get home, the clothes that you've been wearing, just wash it straight away in hot water if possible. Go and have a hot shower, wash thoroughly. Then after that, no problem. Okay? Okay. Of course, if you don't want to get pregnant at this time, then please have your contraception in place. If let's say you run out of contraceptive pills, or you're just going to go and fill up your pills, fill in a bit extra lah. Okay, so that's the advisory from all over the world, that maybe keep 2 to 3 months worth of contraceptive pills with you, some condoms. If your intrauterine device is about to run out, maybe get it changed. So just again, talk to your doctor, and they'll be better able to advise you on that. Now, another thing is that if you're too lazy to have a shower, please don't use the alcohol-based sanitizer on yourself, okay? It burns, all right? Chemical burns, not sexy, so don't do it, all right, please. All right, number 6. Okay, the next one also very interesting. How do you maintain the spice in the relationship during the MCO? Okay, so I have read a little bit around when this topic was given to me. And according to some psychologists, that actually sometimes it's better to be a little bit away, then you miss each other, then you come back, and then you forget about all the irritating things that happen to each other, right? Okay, so now you're cooped up in the house 24/7, can be quite irritating, okay? All right, so I would say maybe an idea would be, get dressed up. Okay, I know this is a controversial topic now, all right? You can get dressed up, pretend that you're going on a date, put the kids to bed early, okay? Pretend that you're going on a date and just romance each other a bit lah, okay? I guess some people, if it strikes, you can dress up and pretend to be other people. Okay, that's a bit controversial. But, there's some things that you can do to maintain some spice in your life, One of my staff said to dress up as the COVID virus and chase each other around the room. I don't know, but well, if it suits. Okay, so those are a few ideas that you can have, but you can pretend to go on a date. and see how we go. Okay? Right. So the next one is someone who's single who's written in and said that they are very worried because that this pandemic, we don't know how long it's going to last. Okay, whether or not, how can I have sex safely because I have needs that I need to satisfy, and I cannot be cooped up all this time all by myself and not have access to some intimacy. I think in this point in time, especially with social distancing, right, the best sexual partner that you can have, if you don't have a steady sexual partner that lives with you, is yourself. Okay, so DIY, right? Okay, so masturbation is safe. It maintains the social distancing that we've been advised to do, and most people would be satisfied by it. And hopefully, we're out of this MCO soon, and then you can then go back to meet your girlfriend or your boyfriend and your wife if you're working in different states. Okay, so so DIY. So okay, then of course there's been some talk about phone sex. I guess you could, if you really trust that person, you can have some phone sex. It's safe, it's still social distancing, but I wouldn't recommend sending any funny pictures or compromising pictures because those things can be used against you in the future. Okay, all right. And pornography, no, please don't, because people are exploited when they are making porn. Okay, all right. So is there any other questions that are coming in, guys? I think I've gone through all my questions already. So I guess during this time, the best thing to do is actually to stay safe. All right, and maintain your hand hygiene. Don't go out unnecessarily. Don't go out shopping just because you're bored, because you have to be mindful that those frontliners have families too, and they are very, very tired. The ones that's running our supermarkets, Okay, so keep staying at home. Try not to kill each other. Maybe have sex. Okay, we're just going to wait for some more questions to come in and we'll see how we go. All right, we have a question here that says, what if I have vaginal discharge? Is it urgent to go and see the gynecologist now? All right, so we have advised that all non-urgent appointments and non-urgent gynae problems we can be shelved. But of course, if your discharge is really annoying you, please go and see a doctor. And if you've had any unsafe sexual contact, it could be something that can affect your future. So if needs be, you do need to come and see your doctor, yeah? Okay, so of course you can also call our hotline with Sunway Specialist Damansara Center. You can always ask to see whether you can defer the appointment or not. So our nurses there are also always ready to help you. Okay, one more question. Is there any restriction in kissing my partner during sex? I guess if your partner is safe and does not have an infection and is not having any flu-like symptoms and you guys have been together for the last couple of weeks, then there should not be any restriction. But if, let's say, you guys, if you think that the person is of like a PUI or person of unknown infection status, or they are pending their COVID test, then no touching, no kissing. Okay, but it is not spread that way. Okay. Another question about safety, about getting pregnant now during the pandemic outbreak. We have not said that you cannot get pregnant, but most fertility centers are now discouraging people from transferring their embryos because we are not sure how it's going to affect the pregnancy. Like I said, it's still early days. It only broke out in Wuhan at the end of last year. and it's only been 6 months down the line. So, and there have not been that many pregnant women in any of the research papers that have come out. But so far, it says that there has been some worries, but there have not been any clear association between fetal baby abnormalities, miscarriages, and problems. The only problems arise is like when you are in labor, and if you need a general anesthetic, then it can be a problem for the doctors concerned. So the other thing is that when you come and see a doctor, please be truthful to us. We are only trying to help you. I know some people don't want to tell us where they are, whether they've had contact and stuff, because they're worried that we will not provide treatment. Please be rest assured that all doctors are very professional, and we are prepared for the eventuality that you might have COVID and we might get infected. In fact, we are treating everyone as if they potentially could infect us. So we will not deny you treatment, but please be truthful to us, because if all the doctors are wiped out and if all the nurses are wiped out and we're all down with COVID, then there will be no one to help you. So please help us to help you and be truthful. If a mother is pregnant and she gets COVID-19, will the baby get it? Well, so far we have not, there has not been any demonstrated cases of what we call vertical transmission. It means that the infection goes from mom to baby. Okay, so far there's none. Of course, we are worried that that could happen, but like I say, it's early days. So some people advocate that the babies are isolated from the mother if the mother is proven to be COVID-19 positive until the danger period has passed. Some people say just keep the baby together. Breastfeeding, we're not quite sure where that stands right now. So at this point in time, it's best to talk to your doctor if you're pregnant and you're concerned. Is it safe to have a baby in the hospital where there is a risk of getting COVID-19 while you birth in the hospital? Okay, a lot of my patients have asked me this question, and the question is that, does your hospital have COVID-19? Is your hospital starting to accept COVID-19 patients? Okay, first of all, according to Ministry of Health directives, we do transfer any patients who are COVID-19 positive to a government facility, 1. 2, I think that is not the correct question to ask. The correct question to ask yourself is not so much does the hospital have COVID-19, but what your hospital has put in place to make sure that any COVID-19 infection has been well contained. And again, I'm very proud to be associated with the Sunway Medical Health Group, because I think we are very, very conscientious about that. If you can only see the messages that I get every day from our task force, you would know. Every day they are meeting up, and every day they are coming out with new guidelines. And although sometimes it's a real pain, but you know, it's keeping all of us safe. And from all the guidelines that are coming out all over the world, I really think we really have a very firm hand on this. And I think Sunway is probably one of the safest place to be at this point in time, to be perfectly honest with you. I know I'm blowing the trumpet on my own workplace, but that's how I feel. So I don't think you should be worried to come to a medical facility, because we are well equipped to handle, and patients who are proven to be COVID-19 positive are shipped off to a government facility. But please bear in mind that this disease is everywhere now. You know, it's in the supermarket that you're in, it could be in your office, it could be in your building block. That's not your worry. Your worry is that you should keep yourself safe. So if you keep a mask on, and you wash your hands and don't keep doing this all over your face, then you should be quite safe. In fact, studies have shown that if a sick person wears a mask, actually we are all quite safe. So if you're sick, please keep your mask on, because that will keep all of us safe. Okay, so don't worry about the hospitals having COVID-19, because if you're a big enough hospital, you're going to run into a COVID-19 patient. What you should worry about is what your hospital has put in place to keep you safe. Okay? All right. So someone has said that I'm worried about going to the clinic for antenatal visits. What is your advice? Well, there are some visits that are more crucial than others during the pregnancy. And in those crucial visits, then you should really go, because in the end of the day, the health of you and your baby is paramount. And there are reasons why we put those visits in place, because we want to be picking up trouble before it starts. So if you are worried and you do want to defer your appointment, then I really think you should pick up the phone and speak to your doctor providing care, and ask them if it would be okay for you to come 2 weeks later, or it'll be okay for you to like miss the appointment, but have another appointment in place so that you're not missing crucial appointments. So that will be my take on that. Okay. Is vaginal cleansing soap recommended? Ayo, no, please don't do that. Okay, I think just normal hygiene. All right, if you take a shower twice a day, once a day, make sure that you're clean, soap yourself everywhere, you'll be fine. Okay, let's not go crazy here. Don't use Dettol and put it up there in the nether regions. You'll be wanting to come and see me for chemical burns. Please don't. Okay, so just normal hygiene. No need to go extra mile. No need to use Clorox all. Okay, please. All right, so just be sensible at this time. Just normal hygiene applies. All right, I think the normal things that we do to cleanse ourselves is plenty enough. Okay. When should couples stop having sexual intercourse? Never. I don't think you should stop. Okay, unless you are COVID-19 positive, then please stop, because you should be socially isolated from each other. The other day, I had an interesting conversation with some of my colleagues as to whether or not the husband should be allowed in the delivery suite to the wife while the wife is delivering, because after all, they're exposed to each other. So yeah, so I guess if you guys live together and there's no possibility that you guys are infected and there's no worry about infection, then you don't need to stop having sex. Okay. Of course, if one person doesn't want to have sex, don't force that person to have sex, all right? No means no. Consent, even in marriage, is important. So don't force people to have sex with you. That's not good, and it's criminal, actually. Okay? Right. Is it safe to have a baby in the hospital? Is there a risk of getting COVID-19 while delivering? Well, like I said, there's always that possibility because the virus is everywhere now. But I would say that it will be minuscule. Okay, you'll probably be at the same amount of risk if you're out shopping somewhere. Okay, and in Sunway, we actually ask you to put on a mask while you're in labor, and this helps to protect you and us. Okay, so your healthcare professionals and your healthcare providers, the nurses, the doctors, we will all be having a mask on while we are conducting your delivery. So, and you will have your mask on as well, and your husband if he chooses to stay with you during the delivery. So all of us will have masks on to try to contain the spread. So as much as possible, we will do that, because we are even more mindful about protecting our staff, because if they are down, then we are seriously in deep trouble. Okay, so not to worry there. Okay. Right, I think we've come to the end of our session now. All right, and now, so what is my take-home message? Number one, it's okay to have sex, but please make it safe. If you don't want to get pregnant or contract any disease, the condom is still the best. But any contraception of choice should be continued in this period. Okay. Second thing is that if you have flu-like symptoms and you're ill, please do isolate yourself. Don't be truthful to your healthcare providers. We are just here to help you. We will not discriminate and not treat you in any way. Okay. And also, screening, it's affordable, it's available now. That's something that you could think about. And the third thing is that stay safe, stay home, sanitize regularly, hands, not genitals. Okay, and if you have any further questions, please reach out to your doctor or to us. We'll be happy to help. Okay, bye. Finishing. Oh no, technical problem.